One.
Good. Good evening, everyone. Welcome to the CYP meeting. It's going to be a very full evening, and we hope, well, to do some really good work this evening. There are quite a few changes, and so the first thing I think I should just tell you that we've had a resignation from one of our co-op representatives, and we've got a new person, Roz Cordner. She's just put her hand up. She's possibly temporary, so but she'll be around for a little while, which is quite good. And there are a couple of people which I will mention in a minute. So, apologies for absence, please.
Yeah, we've had apologies from Councillor Dennis Pearce, and we have Councillor Carl Quilliam as a substitute.
Okay, thank you. Otherwise, from that, I think we've got anybody from the other side? No. That's okay. Right, okay. Sorry,
Chair?
any declaration of it? Sorry?
I think there's another apology from the Labour side, isn't there?
Yes, but that has been discussed and it's been moved as a new person.
Councillor, just to clarify, yeah. It's not an apology. We've had a change of membership.
Yeah. Okay, that's right. Yeah. Okay. Thank you. Declaration of interest, anyone? No, great, okay. Minutes of the last meeting. I think we should just go from page to page and see what's happening. So page 1, anything from anyone? I presume you've read the papers. Yeah. Page 2. Page 3. Page 4. And page 5. Some of the issues that's mentioned there will come up again anyway. Right, thank you. So we have now a few changes, and so we've been asked to ask Public Health to come and speak to us. Dagmar is going to be here, and everyone, because we have so many things, we won't be talking for a long time. So Caroline, I'm so sorry, we're just going to push you back a little bit. Okay. Dagmar, I was told that you might want to talk about asymptomatic testing. So if you could add that to it as well, please. And if you wouldn't mind, we are all ears.
Thank you very much. And thank you for moving the agenda around, really appreciated. So I've got a few slides, and in two parts, I will talk briefly around what the data look like in terms of COVID infections. And bear with me, so I hope the slides are a good reference for you as well, so I won't dwell on all, but I've added a few particular relevant ones in for children. And then the second part is only 2 slides on asymptomatic testing. So Chair, if I whiz through the lot and then are open for question, is that okay?
That would be great. So please, can no one interrupt her? Let her finish, and then we will ask the questions. Thank you.
Lovely. So if you could give me the first slide. Oops.
Sorry, I'm having a bit of a technical issue. Please bear with me.
Maybe Stella, while you find the slides, I just talk you through. So imagine the summary message around the infections in London, in Merton, in the country is they're very high. You will have noticed that. So Merton isn't an exception. And just to give you a little bit of a feel what very high means, we have about 300 cases a day. And oh, we've got the slides back. So other indicators that give you a feel how much infection is around you, including in Merton, is that the estimate of in positive cases is about 3% now. So 1 in 30 people we think is infected. So it's even higher than on this slide. And unfortunately, it also means that we have more deaths now in Merton. So for the second consecutive week, it is double figures. So 18 have been registered. So that's the message. It isn't surprising. Unfortunately, Merton is in the thick of it as everybody else. There's one little bit of green shoots coming up, in that the increase, which we have seen really steeply over the last few weeks, is slowing down. But that's about as positive as I can get it. If you move me on, Stella, it's lovely that you found the slides. So this is just showing you that Merton is obviously not in isolation. These colourful tiles show the other London boroughs, but you will notice that the most purple is, I call them the bruised ones, are the worst boroughs. And indeed, Merton has now the unfortunate distinction that they are amongst one of the highest, just hovering under 1,000 per 100,000 in a week. If you move me on. The next one shows you increases, and this is fortunately a slightly older slide. So it was going up 18, 20, even more percent before. We are now slowing right down. In fact, today, but it is only one measure. We've been going down rather than up, which is very positive. If you move us on. This is now the impact of COVID on our NHS. This is a really significant slide. So the main message is the NHS is full. Our colleagues from the NHS have said grim is how it is being described. You've seen it in the news. South West London is no exception. If you look at the lower left-hand side, you can see what it means on a graph. The beds are taken. And on the right-hand side, in the lower corner, it shows you that the severity of the patients in hospital has increased. So oxygen dependency and mechanical ventilation are right up. So if you move me on. Now I share a little bit of more Merton analysis. So obviously we are looking very closely to our partners in South West London as well. And this shows you the pattern between the South West London boroughs. It is a bit of an unpredictable game. Kingston used to be quite high and is much lower now. Sutton is at the moment in the lead. If you move us on. This is an important slide, and all of you can play an important part to obviously promote. Anybody with symptoms should get a test for symptomatic people, a PCR test. We're happy that we've got 2 local sites now, one at Merton College and in Mitcham. And if you again see very stark, on the left-hand side, it started off that people didn't really go there very much. But over Christmas, we were lucky. The Department of Health listened to us and they pushed their capacity. They went over capacity, extended their opening hours, and all slots were taken. And we are now happy that there are enough slots. There are busy sites, but there are enough slots so people can get a test if they so wish locally. So that's a good message to take out. If you move on. This is an important slide for Merton because the East-West divide, we are making sure to keep an eye. And you see that initially there was a lot of crossovers between the West and the East, but it is now diverting. So there are more cases in the East. That's why we're particularly, we're keen to have a testing site in Mitcham, which indeed is very busy. If you move us on. This is the other important bit. We're monitoring the ethnicity of our cases, and you can see the comparator is the right-hand side. That's the distribution of the population. And at the moment, there aren't any very noisy signals that we have got huge disparities, but we're working with our NHS colleagues to find out more what's happening in hospital. If you move us on. Now come more of the kiddies slides. So this is actually a slightly older slide, but I wanted to show you how significant the increase in school-aged children's cases were. You are probably all aware, but I felt this is a really convincing slide that we had a lot going on in our secondary schools. And if you look, we had one school identified as a common exposure for 108 cases. So we had it thick and fast. Obviously now with the schools closed, that has settled down. If you move us on. This again shows you how over time the distribution of infections has moved across the age bands a bit. So at the beginning of December, we had the under 18s, almost a quarter, that has now diminished. And you see that the sort of middle ages are picking up big infection rates now. If you move us on. And this is now where we are, basically. It's all black, it's everywhere. So we've got lots. That's basically what that slide says. And then the last one. These are our outbreaks in schools. And again, you can see how it shifted. We have been very busy before Christmas, you will be all aware. That has gone right down. But what is interesting, that we obviously still have got outbreaks, particularly in our special schools. Some of you will know, Passade had quite a few in staff. And actually really also very much in the press are the nurseries. They are open, but lo and behold, there are outbreaks, not surprisingly, in nursery. It's often just really the mirror of what happens in the community, to be honest. It's not necessarily that it's the sole source is the nursery. So I think that's the end of the data. And if you then swiftly move me over to just 2 slides on asymptomatic testing, because that obviously has been very much in the press and particularly relevant for our schools. Let me just check that I planned it. Again, Stella, if you have difficulties, if I start. So on the first slide, I wanted to talk just a little bit about the purpose of asymptomatic testing, because it is actually quite complicated, and sometimes there's quite a muddle in why are we testing. So the main purpose for us in public health is that we know we've got lots of infections, and we know that a lot of people with COVID are asymptomatic. We think 30 to 40% of all cases. So a logical idea is that if we test people that are asymptomatic, that we find positive people, and then if they isolate, we interrupt transmission. So that's called test to find. Makes a lot of sense. If you think about the psychology of people, though, asymptomatic people find it actually really difficult to self-isolate. God, you feel fine, and then you're asked to self-isolate. So we have to take that into consideration. Also, people who are asymptomatic, normally the psychology is that you test because you want to hear that you are negative. You want a reassurance. We have to, again, if we're starting to asymptomatically test, for example, our staff in schools, have that in mind. And what will happen, and we need to be prepared, is that people, initially you will find asymptomatic positives. They must self-isolate, otherwise it defeats the purpose. And it often gives quite a dip in the staff continuity. All of a sudden you might find a number, and then you need to think how you continue with your service. But obviously in the slightly longer run, that is much better, because otherwise they would happily spread. The other bit, why we want to use asymptomatic testing, it was still the other slide. It was what we call test to enable. And test to enable is specifically to confirm negative individuals so that they can do things that they otherwise couldn't do. So you know, again, in schools, a big issue is that staff, asymptomatic staff, needs to self-isolate because they are part of a bubble. And that takes out a lot of teachers and makes it very difficult sometimes to continue. So test to enable is the use of fast tests 7 days in a row for people to let them out of self-isolation. And for secondary schools, that is already in the school policy. Otherwise, it's not yet approved. But that has a lot of potential to free up people out of self-isolation. And then the two tests that often get mixed up as well is we've got the PCR test, polymerase chain reaction test, which is highly accurate but needs the laboratory. So there's also a turnaround time. Sometimes we use that for asymptomatic testing, care homes, for example, but mainly that's used for symptomatic people. And then the lateral flow, it's called an LFT or sometimes an LFD, a lateral flow device. That is lower in accuracy, but you've got the result there, and then you do not need a laboratory. It's a bit fiddly, but it can be done. And we are very excited about the announcement, and there has been some confusion, but it has been announced that for primary schools, their asymptomatic testing can be done with a home testing kit, which is liberating. So that's just a little bit about the principles and overview. You are an important people to ensure that there isn't muddle out there. And then just our model for asymptomatic testing in Merton. So first of all, our focus really is on targeted use of that, purposeful use, particular frontline staff. And now we're in lockdown, we're talking about frontline staff that cannot work from home and basically all help us with essential stuff. So school, particularly those SEND schools, early years that are expected to be open. And the regime is you test once or twice a week. And then we also give opportunity for residents to test. But you will remember at some point it was all about mass testing, and it was the Liverpool example. This is not what has been shown to be particularly helpful, and not at all in lockdown. So we try to target it. The way we offer it is fourfold. First of all, we really support national testing programs, and that is in our schools. We've got local community pharmacists, and we're very happy. We've got now 11, possibly 12. We have got them rolled out now also in the East. We had to cajole them a little bit more, and more are on the sort of in preparation. Then we have got what we call devolved testing for staff. The early years are very interested that we actually work with early year providers and say, how can we help you to manage your own testing program? We will receive the tests from the Department of Health and the other supplies that you need, PPE, etc. We will help them. There's a operating model, there's some sort of clinical governance. We help with all the oversight, but ultimately we then hand over and say, you can run your testing. And I think looking at what's happening in secondary schools, they're pretty brilliant. They have picked it up really quite amazingly. And so more devolved stuff is coming down our way. And just today, there was the announcement that there are more national programs as well coming our way. So the Met Police, the Fire Service, TfL, big retailers and businesses above 250, all will get their tests directly from a national program. And then finally, some of you might have used Modern Assembly Hall. That is our site-based testing site. And we use it for both frontline staff as well as for residents, but you must book. That is very important. And we would say do not travel simply to get a test. And we say if you are shielding, please do not go for an asymptomatic test. That's me done.
Thank you very much, Dagmar. That was very comprehensive. We've got one person wanting to ask a question. So Russell, go ahead, please. Okay, should I do 3 at a time? It's probably easier for you.
Yeah, bundle them up.
Russell, Joan, anyone else? No. Okay, Russell and Joan, please.
Right. Thank you for that, Dagmar. Could you tell me on average how long a COVID sufferer stays in hospital?
I haven't got an average number up my sleeve. It depends a lot around the age. So the older the person are, and particularly if they have comorbidities, so other illnesses, then the length of stay goes up a lot. So I can probably find you a curve that is very age and comorbidity dependent. But one figure I haven't got up my sleeve. So I'm sure I can ask my NHS colleagues. But as I said, the meaningfulness is by age.
Thank you.
Thanks. Joan, please.
Thank you. Oh, thank you, Dagmar. And my 2 questions are, can one get the vaccine if he or she are COVID positive? And the next one is, can one still transmit COVID after they had the vaccine?
Yeah, so I think, Joan, really good questions. First of all, if actively COVID positive, you do not get vaccinated. And the reason is primarily to protect the people who are giving the vaccination, because what we absolutely do not want is that our vaccinators are at risk of getting the infection. So what we, for example, do in care homes, where we have lots of outbreaks, we vaccinate all the people that are not COVID positive, but wait for those that are COVID positive to recover, because we have got some care homes with positive patients. What is behind the question, though, is can you get vaccinated if you have had COVID? And the answer is yes. And we recommend that you get vaccinated because there has been the recent hailed paper in the New England Journal that has looked at immunity. And so there's some confidence now that you have some immunity 6 to 8 months after a natural infection, but we do not know how long it lasts. And so the recommendation is, regardless of whether you had COVID or not, you get vaccinated, but not when you are acutely ill afterwards. And then the second question, remind me what it was, sorry.
Unmute yourself, Joan.
Mute. Yes. Can you still transmit COVID after you had the vaccine?
Oh, yeah. So really good questions. At the moment, the former standard answer I meant to give you is we do not know. And hence the official recommendation is that after you've been vaccinated, that you still have to adhere to social distancing. Now, what I know from my infectious control knowledge, it is very likely, and they're still doing the ongoing studies, that once you're vaccinated, which protects you against severe disease, that it is most likely that you transmit less. But because we do not know, the official line at the moment is behave as if you could still transmit until we have better data. Is that all right?
Thank you.
Thank you very much. There's just one more person. Hayley, please.
Okay. Thank you, Chair. And thank you, Dagmar, for yet again another comprehensive presentation. It really is appreciated. I know that you are spending many evenings doing this at the moment. My question is vaccine related again myself. I wonder whether or not you could update the panel and people watching on the number of vaccines that have actually been administered in Merton to date. And still on vaccines, what will the rollout look like for Merton in the coming weeks? And where do you anticipate that people will be able to become vaccinated once the vaccination programme does step up a pace? Thank you.
Right. Hi, Hayley, thanks. What I might do, if you allow me, Chair, I know that Phil has got a few slides on vaccination, which cover all those points, or most of those points. I don't want to put him in a difficult place. So is it okay if we pass those on?
That's absolutely fine.
Yes, yes, I was going to say actually that Phil is going to answer those.
Okay.
So if you could come in now, Phil, please. Need to unmute.
Yeah, thanks, Chair. So on the first question, in terms of the number specifically that have had the vaccination in Merton, we don't have a figure for Merton specifically. We have a figure for the ICS, which is South West London, which is just over 40,000 is the figure. Can you remind me of the second question? Because I was scrambling through my slides as Dagmar said I have a set to find the answer for it.
That's absolutely fine. Is that okay, Chair, if I actually answer that question back? Okay. Phil, well, thank you for answering the question in terms of the number of vaccines, and hopefully over time we will actually get that number by borough as well. But my other questions were, what will the rollout look like in the coming weeks to come? And where will our residents in Merton be able to have a vaccine administered once the vaccines do actually step up a pace as well? Okay,
thank you for that reminder. So the delivery model for Merton is in different strands depending on the cohort. So the first rollout was through the hospital vaccination hubs, and that was because the first vaccination was the Pfizer vaccine, and the hospitals have got the ability to store it at the correct temperature, so the very low -70 and below temperatures. The second route is through what are called primary care network designated sites. So that's a GP practice that is acting on behalf of a cluster of GP practices. So we've got several PCN sites in Merton. At the moment, we've got 2 PCN designated sites operational. That's the Wilson and the Nelson Centre. They are predominantly focused at the moment in vaccinating the top age brackets, so the over 80s. They do also have overspill to support the vaccination of health and care staff, and they're also primary care is the focus for the rollout into care homes. So you're probably aware of the target date for those top 4 cohorts of the middle of February, and working to a timeline towards the end of January for care homes residents and the staff. Beyond that, the JCVI set of priority cohorts moves down the age brackets by 5-year age categories, and the 6th, the kind of anomaly within that, the different set, is those who are clinically extremely vulnerable that come in at number 6 on the priority cohort list. The other part to the delivery jigsaw is then the mass vaccination or vaccination hubs, in a similar vein to Dagmar's just been explaining testing. There will be standing up several mass vaccination sites. Again, you're probably aware that 7 of those went live nationally. The closest to us would be Epsom and the XL in London. There are several sites in South West London. I'm not at liberty to disclose where those are now, but they are due to, the first ones, those are due to come on stream the week commencing the 25th. Does that answer the question in terms of the rollout procedure? Beyond the cohorts that are categorised in the JVCI guidance, which stops at the over 50s, it is at that point that it will then flow into general population vaccination.
Right, thank you. Just one more person, because I'm worried about the time and everything else. Russell, please.
Oh, right. I didn't know I got another opportunity. Basically, what on vaccines, what about people who can't make it to the place of being vaccinated? Housebound people who are over 90. I know this panel isn't looking at that, but I'd be interested to know the answer.
I can answer that for you, Councillor Makin. Apologies, I should have linked that into. So within that delivery plan from primary care, they also have aligned to them what's called a roving team, and that will be managed by our community health provider, CLCH, specifically for cases like at the moment the over 80s who are housebound and other groups who are housebound and can't get to a physical site, or it's less safe for them to travel to a physical site to take it.
So they're going to come out and do it here rather than right.
Okay, right. Thank you very much. Very interesting, and also it's really food for thought, and it should make us all more responsible than we are at the moment. So if you want to go, you can do it so that we can start. And Hannah, I think we'll do ours afterwards because I can see that Caroline is waiting. So we can do that after too. Caroline?
Thank you, Chair. Yes. Do you just want me to kick off then? All right.
Yes.
All right. So thank you. So what you have in front of you tonight for the budget and business plan update is included within the report an update for the Cabinet report which went in September, setting out the latest, or at that point in time, an update to the MTFS and the budget gap and some of the review of risks and assumptions that we put into the plan. We then had the November Cabinet report which set out what savings have been brought against those targets that have been delivered. And then the December Cabinet which had a further update on what the gap was going to be, and the equality assessments linked to the savings which came forward in November. You would have had delivered, hopefully over the Christmas period, the information pack, which then has all of the detailed savings. It has the full draft equality assessments, and it has service plans. So what I will sort of talk you through mainly is the December Cabinet report, because that showed you where the gap was, the work we had put in train to do with that, and also the fact that the settlement was so late. We are bringing a further update to Cabinet next Monday. There will be a further round of scrutiny to look at further savings and options for you to feed back to a special overview and scrutiny meeting on the 17th of February, to then have we had an additional Cabinet on the 22nd of February to bring everything together. It has been one, I think, of the most difficult and challenging years to pull a budget together, where there's still so much that we don't yet know. And yet what you all want from me is certainty as to what that gap is, and please have no more savings. And I'm not sure I can give you that certainly at this stage, but we work on sort of the basis of the most reasonable assumptions we can make. And obviously with some of the funding that we have got from the settlement, we'll look to reduce the gap, but it won't necessarily close it fully. So what we have also got in front of you is the details of the draft capital programme for next year and the following 3 years, which is particularly interested to this panel with the schools expansions, mainly secondary schools, and now building on with the special school expansion to help offset some of the increase in our dedicated schools grant, but not fully at this stage. That will still take some time. So you will see when we went through looking at updating the assumptions, we have reduced the amount that we had set aside for pay for staff. Whilst the government has said for those that they fund directly that there will be a pay freeze, they cannot actually direct local authorities to do a pay freeze, but the Employer Association will be looking at what the pay award will be for staff. So at this moment in time, we have left that provision in and reduced it to 1.5%. You will see, for those of you who are Freedom Pass users, that clearly with the reduction in travel for the majority of users across the London transport system, that has for once had a beneficial benefit for us in towards the contributions towards paying for that scheme. Although the double whammy will be for the TfL preset going up significantly next year to pay for the over 60s and the under 18s travel as well. But we have seen a benefit for the reduction of that, and that has been built in. When we were looking at the budget, there were issues around sort of the gap that we thought we would have anyway, and the gap that we thought may have arisen through either issues arising from COVID or other areas where we're not getting sufficient funding. So that was where we brought forward savings on that basis, and these are the ones that were then presented to the November Cabinet and again in December with the equality assessments. So in particular for this panel, there were savings, two savings, which are detailed in the pack, and when we sort of go on to that part of the session, Hannah, Jane and the team will be able to answer the specific queries on that. What we also put into the pack was an update from the Local Government Association on the settlement, because it came through so late. We were struggling to actually work out what the implications are going to be. So we've got this settlement, and then we'll have sort of further information when we bring the Cabinet paper to you in December. So you will see at the end of December that we said our gap was going to be, sorry, I'm trying to find the right page now, apologies, on page 68, 11.7 million, rising to 12.7 million over the 4 years. So still a significant gap, but we have been working hard over the Christmas period to then look at what the implications are and feeding in some of the assumptions around the settlement that came through. That did include the 2% council tax increase. And then clearly since then there has been an announcement that we will be able to do a 3% adult social care precept, but that of course will have no impact on the bottom line, because that money is all ring-fenced for the adult social care, and Hannah and her colleagues are sort of benefiting from that at this stage. We have had new service plans, so a different format from what has previously been brought in front of you. So those are within the pack for you to comment on and ask them any questions on. They will be coming back in February to Cabinet and onto Council as part of the sign-off of the budget process. So there's sort of certainly more detail in there, and a combination of what used to be in our target operating models around services improvements, where we were looking to make changes, procurement, information technology, linking with the savings and performance information. So hopefully you will see that there's much more detail in those service plans to enable you to get a feel for the service areas, and clearly the draft equality assessments for you to see, have we missed anything from what we are currently saying the impact of the two savings in this area are for, and then obviously to give any feedback if you wish to back to the Commission on next week. We've also sort of put in the December Cabinet the latest position on monitoring, and indeed if you look already on the Cabinet papers for next week, you'll see an update for the month 8 monitoring and a further improvement in the overspend there, and hopefully that will continue as we move towards year end. And particularly for this panel, there is a net underspend for children's schools and families, even after looking at the impact of COVID. Happy to stop there and take any questions generally on the budget and some of the papers before we move on to the detail of the two savings for this panel. Thank you, Chair.
Thank you, Caroline. Any questions for Caroline? Okay. Russell and then Hayley, please.
Thank you for that report, Caroline. Could you explain the position that we stand on the about DSG, please?
We're in a deficit. That's probably enough to say at this stage. So the funding that we get from the government is meant to cover all of the costs associated with our schools. Some of it is delegated directly to schools, some of it is left with us to then pay for certain services. But in particular for us in Merton, we have an issue with the grant not being sufficient to cover our high needs. We do have an extremely high number of education, health and social care plans. They have been increasing rapidly year on year. The age range has increased. So originally they were sort of from 4 to 16. They are now from 0 potentially up to the age of 25. So we're not seeing any currently of our cohort falling out. We're just seeing increased numbers coming through. And the complexity of those care plans have also increased. So at this moment in time, we are looking to bring an update to Cabinet next week, but certainly the update previously was that we were not going to reduce the deficit over the 5 years, and I think that is still very much likely to be the case. So we have been working with other, certainly London boroughs, who were in a similar position to us, but I think we've overtaken them with the size of our in-year deficit. The DfE were coming out to visit local authorities, but they've only chosen to meet with 7 in the country. So 3 in London, which was Richmond, Kingston and Hammersmith and Fulham. They have not come back to meet with us. They originally were due to come back in November, but then they changed it, I think, to just visiting 7 in the country. So whilst there is a statutory override for 3 years at the end, which takes us to 2022-23, we will still have a significant deficit by the end of that period of time. So we still think it would be wise to make a provision, but we will keep it under review. And indeed, Hannah, Jane and I are having now sort of regular meetings to work through what we can to look to mitigate it. So what I hope we bring you next week will be the worst case scenario. And then we will be having some a series of actions to actually look to see how we can reduce that going forward.
Thank you. Hayley, please.
Yeah, I'm actually questioning not on children and young people just yet, because I thought that was the questions that were asked for, Chair, at this stage. Is that right, Caroline, right now? Yeah.
Anything generally on the budget, unless you want to go into
Oh, it's okay, that's fine. I mean, I appreciate and thank you for your presentation and your time again this evening. I think we can probably agree it has been a difficult and challenging year for everybody. I think we've struggled to find anybody in the country where it's not been difficult throughout 2020. And I appreciate that you've mentioned on several occasions that you said that the government settlement has come in late, but I think we all agree everything is incredibly fluid right now. Even for the purposes of the reports this evening, it's moved on from the last couple of weeks, and that's why quite a bit of the updates will be on presentations this evening. So I think that we all have to work within the parameters that we actually have at the moment. Now, you mentioned about in terms of what the deficit looks like currently, and I apologise, I haven't looked at cabinet papers for next week. So I wonder if you could actually update us on what the gap will look like now. That's my first question. The second question is, and I couldn't see within the report, but I am aware that there's an additional day's holiday being granted to all council officers, and I'm wondering what the cost of that will be to the council. And also if you can actually, just based on what you just talked about there, it's my third and final question for now, Chair, is you mentioned about a net underspend even after COVID within children and young people. If you probably explain why you think that is as well, please.
So the gap at the moment, so we haven't finalised papers for Cabinet for next week. We're still working on those and hope to get those published as soon as we can. So the latest budget gap that we've got was what was reported to Cabinet on the 7th of December, which is set out on page 68 of this report, which is the 11.739, or there's a bit more detail on page 78, which shows how that gap changes over the next 4 years. So that's what we will look to update within the January Cabinet papers, with some more details of the settlement and additional grants that we did receive. With regards to the additional days holiday, we think the notional cost will be around £300,000, because clearly not everyone will take that day's additional leave. So that's just what we're saying at this moment in time. That could be the potential maximum cost, but it will remain to be seen if everyone does take their leave, because clearly we are, our workforce is so good. They are really dedicated, and we are trying to force people to take their leave. So there is a significant amount of leave outstanding because of just the issues and the pressures of people trying to deliver the response to COVID, as well as delivering against business as usual. With regards to the underspend, so certainly within this report, we do have the November underspend. I'm just trying to find where we've got some details. So on page 61, we show what the monitoring was for the end of October, and for CSF, the non-COVID underspend was 2.1 million, COVID expenditure of 900,000, so a net underspend of 1.3 million. So in particular, there was some growth given in some of our home to school transport costs, Clearly, as children were not being transported in the early part of the year, we are seeing some savings there. But as there was some travel back to school before they got closed again this term, there will be some additional costs coming through. But there has been some delays in those costs coming through. But that's certainly an area where we are seeing some underspends. And then we have seen some more additional children coming on to needing a child protection plan, but we're not necessarily seeing an increase in costs in those cases coming through, but we're keeping an eye on that. So I don't know just if that's sufficient for you at this stage, but clearly in the monitoring report does have some further details as to where the underspend arrives in those particular areas.
Okay. Right. Thank you very much. I think you have really been delving in as usual to what you have to do. And yes, somebody just put their hand up. Okay, last one before two people now. Okay.
I think James has been up for quite a while, actually.
I just get them in quickly. Omar, please, and then James.
Thank you, Chair.
Thank you,
and
Chair.
Stephen next, third, and that's it for this bit.
Thank you, Chair, and thank you, Caroline, for your updates and the report that you provided tonight. It's a difficult time for everyone, and especially the council during this this time. On page 68 and the budget strategy, you mentioned that the government funding notified by the local government finance settlement seats, the local government finance settlement will be known at the end of December. I was just wondering whether you had an update on that point at all.
So certainly we got information on the 17th of December, and that's what will feed into the budget report coming to Cabinet on Monday night. But there are some gaps in that data. So we still don't have, I think Dagmar's gone, we don't have the announcement of the level of our public health grant, and there are some specific housing grants that we still don't have the details of as well. But we have some information to bring you an update of, but still not everything at this stage.
Do we know when we expect to have that information available?
Hopefully before the end of March.
Okay.
But still, but before, it maybe be after we have to set our budget.
Thank you.
Okay, James, please.
Thank you, Chair, and Caroline, thank you for your report this evening. And I agree with what everybody else has said. Incredibly difficult time for you and for your team. So obviously, it's our responsibility as councillors to support rather than criticise. There were three questions I wanted to ask you briefly on policy. The first is obviously to allow. I know that we're not allowed to use capital funds in revenue. But I just wonder, has there been any talk of that at national level or between you and other finance directors, other directors? Because clearly that's something that in one swoop could help the council if we paused our capital expenditure, which then has further revenue implications when it is implemented, and release those funds. Now, I believe it might even take legislation to change it, but I wondered if there was any talk of that. Secondly, whether there's been any talk of or consideration given to a tool that the government do make available, which is a social impact bond, whether there is some possibility of being able to raise additional funds now that could be paid back over a longer period of time, given the emergency, given the general national crisis, that is a tool available to us. And then the third thing I wanted to ask you is whether you, and I'm sure you are, but whether you are exploring cross-borough services and further cooperation, further pooling of services. Chair, I had a question for Cabinet members. Do you want me to put that now or do I put that later?
I think probably later, please. That's enough for Caroline for now. Thank you.
All right. So
okay, that's it then. Thank you.
All right, thank you. With regards to capital funds for revenue, what there is, you are able to charge some of your revenue cost to capital, so which is called a capitalisation directive, but you need MHCLG approval to be able to do that. And certainly that's what Croydon and I believe Bexley have been exploring, but that's normally seen as a last resort. But those certainly for Croydon who issued a Section 114 notice, they are waiting for confirmation that they will be able to capitalise some of their revenue expenditure, but that pushes some of that further down the line of having to deal with that issue. For some, if we stop some of our capital expenditure to save some of that revenue money, certainly within this portfolio, we are expanding some of our special schools to reduce the impact on the dedicated schools grant. So that would actually cost us more in some areas. What we did this year was actually stop any bidding against the capital programme because of the shortage of funds that we had available. Any new schemes that came into the programme were either externally funded or funded through SIL and the Community Infrastructure Levy. So we have tried to mitigate any additional impact on our capital programme to reduce that impact in the short term. And all the schemes that we have in there, we've asked people to review to make sure, can they be spent this year? Do they need to be slipped, or can they be given up? So you will see there has been some changes in the capital programme as a result of that. And then also clearly subject to the outcome of the call-in, that was one of the impacts of the closure of the housing company. It will then release some of the capital funds that have also been set aside for future spend in that area. So we do try and look at the round, but there is still certain things we would need to get approval for to be able to do some of the policy changes that you're asking about. And unfortunately, permission isn't always given very, very lightly. Certainly, we will always explore the cross-borough services. And one of the ones that we're looking at in my own area is insurance. So we're exploring opportunities there to see if we can work with other boroughs to provide that. In times it can be quite difficult to find people who are willing to come together to look at some of the services, just because you either need different things or you may be in different areas, different places with regards to the need to find savings. And the impact of what that might mean for those services, but we certainly don't rule anything out and are always willing to explore and be part of that. And I think we still work on the basis we'll do anything with anyone anywhere as long as it benefits us.
Thank you, Chair. Thank you, Caroline.
Stephen, did you want to say something? Yes. Sorry.
Thank you, and it's an honour to be on this panel tonight. I just wanted to thank Caroline and all the directors for their time tonight. But Caroline, I've seen you in action over the last 10 years, helping us through these very difficult times, and thank you for everything you do. Just wanted to thank you for the sensible position on the DSG. A median position is the right way to go there. Wanted to thank you for not kicking problems down the road, not kicking the can down the road by usurping innovative but unhealthy ideas about capital and revenue. And finally, thank you for continuing to explore sharing possibilities. As we all know, we have the legal partnership, which enjoins Wandsworth Council as well, and we have the regulatory partnership which enjoins Wandsworth Council as well down the road. Can I just ask, and thank you for, and Ellie in particular, for continuing with the school expansions, but on the special school expansions as a way of dealing with the SG, that's really clever and well done on that. What is this special school? Where is it? And is it currently in play? And is the expansion going ahead?
Right, thank you. I take it that's everybody now. James, can your question stay, or do you want to ask it now?
Sorry, Chair, calling me again, did you say? Oh, I see, for cabinet members, okay.
So, sorry, can we have the answer to my question?
Oh, apologies. No, do I want to answer?
Sorry, I thought your question was answered.
So
it sounded like statements.
Yeah, if I put you to page 82 of the papers in front of you for tonight, you will see the levels of expansion for the special schools. And I think Jane may be able to talk through the detail of where we are. We're sort of we are expanding already some schools, and I think we're in the process of letting tenders for others. I don't know, Jane, if you want to give some specific details there.
Yeah, so as councillors will be aware, so we've completed the expansion at Persade School, the expansion at Cricket Green. Again, the building's complete, but the children will be coming in gradually. Obviously, once we're able to expand that further once COVID's lifted. We've opened the art on the site of Stamford School, so that's an additionally resource provision on one of our mainstream sites, and the current projects that are underway are expanding Melrose School, both for younger children, so for primary age children, and also the medical provision, so that's more for our young people with mental health needs or who are very anxious and unable to attend school, so that provision is also being expanded. So those are the ones that are actively underway at the moment, and we also are looking to develop further ASD provision, and at this point we are exploring whether that could be an expansion of one of our existing schools or whether we go out to procure for another provider to deliver that.
James, please, do you want to add your question now? James? That's it. James? He's not coming.
Thank you, Chair. Thank you, Chair. So I had a question and a comment. My comment, picking up on what Councillor Ambritis has said, I don't think there's anything wrong with looking at a pause in the capital programme given the environment. I, as chair of governors at Melrose, am one of the principal beneficiaries, but I'm surprised at his view, given that the capital expenditure then leads to further revenue expenditure and therefore further financial problems. And I'd have thought, as the former leader of a business-like council, he would be in fact open to considering all options at the moment. My question, Chair, to the Cabinet members, two questions. Firstly, a year ago, I asked about what services could be charged, what commercial services could be offered. So can I have an update on that? Obviously, it's even more critical now that we look at any commercial services we could offer to, whether it be private schools or other boroughs where we could be making a charge, or even increase services to our own schools. So it'd be good to get from Cabinet members an update on that progress in the last year. And then my second question, and there may be a very good reason, I'm very mindful of the horrific year we've all had, but just to understand why last year's agreed savings were frozen as a matter of policy, as I understand, if I've understood that correctly, why they were frozen as a matter of policy when some of them would appear not to be COVID related, but I do appreciate it may be because of COVID. But Chair, thank you. Those are my two questions to Cabinet members.
So you want Cabinet members and nobody else. Eleanor, do you want to add something, please?
Yeah, I'll go first, and then happy for Tobin and officers to come in more detail if relevant. So on that last point first, James, two of our big savings could not have been done without extensive consultation with the communities. So one of them about looking at short breaks and one of them looking about send transport. It would have been wholly inappropriate for us to go ahead of that without consultation with all the relevant groups, and that simply hasn't been possible during this period. So we are looking at those again now, and that work will be taking place this year. On the charging fees to our schools and to other schools, so one thing to note is we already do a fair bit of that. Kind of schools have to kind of buy back our services, and we do charge out to some others as well. I suppose the thing to note is that lots of other local authorities are looking at this at the same time, and schools are in a pretty difficult financial position as well. So it's not like they're going around buying from other people where they could be buying from us. But I agree that it's something we should always be thinking about what is it that we have the competitive edge over and where we could be offering more support. Jane, can I ask if you've got anything to add to that specifically, if that's okay, Chair?
In terms of schools, so through our schools forum, our schools already work really closely with us, delegate funding to help work across schools, and certainly we have a full suite of services. We have service level agreements that they do pay for. So there is quite a lot that we're already charging schools for, and there are some things that we can't because they're our statutory duty to deliver.
So, Chair, can I just come back on that?
Just 1 minute. You asked for answers to be given, so let's wait for a minute. Tobin, do you have anything to add, please?
I don't think I can add much to what Eleanor has said, Chair, because I wasn't in this position a year ago and I wasn't aware of Councillor Holmes's request. What I would say is that a number of the savings proposals we are looking to bring forward in the next round are income-based proposals rather than savings proposals, albeit they are not within the remit of this panel. But that is something that we obviously actively look at. And I hope on our previous dealings, he would acknowledge that I'm very happy to work with councillors from other parties. And if he's got any specific ideas for proposals, I would be very happy to have a discussion with him about those and explore those further with Ellie.
Okay, thank you. Last bit, but not too long, please. We've got lots yet. James. Thank
you, Chair. So absolutely, I know that's the case, Councillor Byers, so thank you. And Councillor Stringer, I completely understand why savings had to be delayed, so that's very logical given what's been going on. But my question on commercialisation, I know, I mean, thank you to you and to Jane McSherry for explaining how it works. I already know how it works. My point was, my question a year ago is, what additional work are we doing to see what else we could be doing in order to be earning money? Now, I appreciate, I am very, very strongly of the belief that it's a very tough environment and we all need to be working together. So I'm not asking for any further comment. It is difficult times, but please do bear it in mind, because I want to ask the same question in a year's time. You know, we do need to be looking to see how we can be earning as much revenue as we can. It's not ideal, but it is where we are. But I take the point that other people will be having the same thought as us. And I take the point that whilst the schools might have a bit more money than us, it's only a bit more. Thank you, Chair.
Thank you. Well, I think with COVID resting or relieving us a bit, we might be able to do the things that you're thinking of and others, because we are listening. It's not that we're not listening to you. Okay. Thank you. Right, I think, Caroline, did you need to add anything before we finish this bit?
Well, I suppose just if there was anything on the capital programme, or before you go then on to the detail in the information pack of page 14 and page 15. So that was all, Chair.
Okay, thank you. Okay, so we can move on now then, I think. Hannah? I'm sorry about the delay, but you know, this is how it works sometimes.
Chair, that's absolutely fine. So in front of you tonight, you have two savings that for scrutiny. The first is around PFI charges, and the second around the rationalisation of children's centres. And Jane and colleagues across CSF, before I joined CSF in this interim role, has been doing a lot of work in the background around this. So Jane is going to give you some of the context and the detail, and then we can open it up to questions. I just want to make one comment in relation to the rationalisation of the children's centres. This saving is 22-23, and that is because we are at the very early stages of this. It is a proposal. There's a lot of work to do in the background that I know Jane will set in context for you, but I just wanted to raise that very early on. So if it's okay with you, Chair, I'd like to hand over to Jane to take us through 01 and then 02, please, Jane. And I think Caroline has already mentioned that's on page 14-15. Just to comment, colleagues, as well, or sorry, panel, in the EIAs, that's the Equality Impact Assessments, starting on page 28. Can I just again be clear that these are in draft and they will be developed further as we work through the proposals? Thank you.
Thank you. So, could you continue then, please?
Yeah, so if I can just do the PFI one first, because that's probably more straightforward. So the saving around the PFI is because it reflects the recent increases in receipts from school contributions, and that's due to the fact that there's a formula-based contribution they make that's based on school rolls, and because secondary school rolls have increased, their contribution within that has increased. So that's sort of quite straightforward where that saving comes from. We've obviously done a piece of work and continue checking. So we've checked again against the October census just to check that that is not a risky saving, and it's not. There's very low risk of those school rolls going down. They're looking very healthy. So that's where that particular saving comes from. The second saving, I guess I just want to put a bit of context around that. So a children's centre, as defined in the Act, is a place or a group of places. Within the borough, we have 11 buildings that are part of our children's centre network, if you like. We have 2 main centres. So for organisational and definition purposes, we have 2 children's centres and 9 linked centres. So we have 2 main centres, and those deliver a range of early childhood services, and the remaining 9 are linked to one of the main children's centres, and they deliver at least one or part of a core purpose. Now, quite a lot of that now is happening remotely for many families with children under 5, and so, as you would expect, buildings are quite restricted in their delivery. So the rationalisation of that will result in a reduced network of the buildings. However, to date, pre-COVID, some of those centres are only providing 1 session a week, and some predominantly delivering health services. So the next step would be to look at reducing the overall number and focusing that probably in our areas of greater affluence, and focusing our resources in communities that are more deprived, likely to experience reduced outcomes. And one of the things that we found out during COVID is that we are able to deliver remotely to many families, obviously, who have good access to ICT, and certainly in the west and north of the borough that has been much easier to deliver. So we'd want to be thinking probably about rationalising the number of buildings to make those savings while protecting our outreach and remote access to families who may require services wherever that was, and also working collaborative to maintaining services from our centres where we know there's increased vulnerabilities. But this, obviously, the reason why this service, this saving is not next year, it's the year after, is because we want to do a full consultation with stakeholders and with community users of those to test out our theories about what we're going to deliver. We do get income into those sites, obviously, because we have health services co-located, so we'd want to bear that in mind too. Now, I could go through and tell you what all the different sites do, but and some of them deliver at this point deliver childcare only. Some of them are just hub offices for health centres. So, but all of that we would look at as part of the consultation and clarify exactly what each of those centres currently deliver. And as you will know, some of them are school-based sites also. So that would be part of that thinking. I think that's enough, Chair, for a sort of a context starting point.
Thank you very much. Any questions at the moment? No. Good. Oh, Stephen, please. Yeah.
Can either Jane or Hannah just drill down on that consultation? How deep will that consultation be? Name some of those stakeholders, obviously parents as well, because I think that will be very, very important as we look at these very, very difficult decisions. What does that consultation amount to?
Well, when we've done them before, so obviously we've done consultations before around our early years and child centre provision to look at what we're delivering and where we're delivering it. So we usually do that by setting out the key aims of what we're trying to achieve and asking people to agree with whether those are whether they think those are the right aims. Looking at what we would what changes we might make and what the impact of that might be. That would usually be directly sent out to specific stakeholders, but would also be available for a period of time on the council's website, so that anybody could access it, and making sure that we go through councillors and other key forums that we've got to make sure that it's as widely articulated as possible, so that as many people can contribute. So we usually have really good, we know in our previous consultations around early years, for example, and these sorts of, we've had really good feedback and quite wide engagement with those consultations, so we would hope to get that again.
Thank you. And Nick, were you wanting to ask a question?
Yes, indeed. Thank you very much indeed, Chair. It really is expanding on what Stephen's just asked, just to make sure that when we're talking about consultations, particularly given the nature of children's centres, that we're making sure that we try to reach the hard to reach parents who are probably in greatest needs of children's centres. Thanks.
Thank you. And I'd just like to ask one question. Over what period do you plan the thinking the consultation will last? Is it 2 months, 3 months? How long?
I don't think we've got quite that far, Brenda, in terms of our in terms of thinking. I guess it would be we'd want to have it out there for long enough so as many people as possible can engage. So I guess as we think about it and the different ways we would engage. But I think the last time we did one, it was certainly over 2 months, I think.
Okay. Thank you. Well, is that everybody's asked who should or want to ask questions? Fine. Right, okay. So performance monitoring report.
So, Chair, is it all right then if I take my leave of you?
Yes, of course. Thank you so much.
Thank you very much.
Well, Chair, if that's okay. Thank you.
Good evening. Thank you.
Bye. Okay. Performance monitoring. I think that's going to be. Is that Hannah is going to do that?
Chair, it's a department update.
Is it? I thought we.
No, it's
on my list.
Department update and then.
Oh yeah, sorry. Yeah, I skipped that one over.
Okay.
Thank you, Chair. So I think we've already heard this evening that we are working in quite a fluid and changing environment as we are progressing through this lockdown. We do provide department written reports to you, and I discussed this with both the Chair and the Vice Chair, because obviously by the time those reports get to you and we come together, things have changed again. So what we have agreed to do this evening, and I think while we progress through COVID, is we will present you with a very short set of slides and give you the updates, the most absolute up-to-date update of today, so you know where things are. And Jane will cover schools and education, and then we're joined as well by David to give us the children's social care. But before we go into the presentation, I just want to say over the last couple of weeks since I've come in as the interim DCS, this is we're in a very different situation this time from kind of our first lockdown, because of course we're still it's still business as usual for a lot of our service areas. We're still doing a lot of work. You've just heard around the financial situation in CSF and a specific targeted piece of work around the DSG. So I'm very aware of the ask of all of the workforce across CSF at the moment, and very thankful and grateful for the welcome and the support they have given me since stepping in. But I just wanted colleagues to be aware that we are in an ever-changing environment. Guidance do change rather quickly still, and we're still waiting on bits of guidance, especially around our schools. The work we have been doing with our schools is incredibly positive, and we have an excellent group of head teachers that work very collaboratively with Jane and her team, and we've had several meetings with teachers over the last couple of weeks, because as you know, the environment in schools changed quite dramatically really since that break before Christmas right through probably to the 30th of December. So I'm going to stop there, if that's okay, Chair, and I'm going to hand over to Jane, who's going to do the first set of slides. Thank you, Jane.
Thank you. So Stella, can we have the first slide? Okay, so I'm hoping that I've tried to touch on all the things that I think you might want to know as councillors about what is going on. So so you'll be aware that under the national guidance, nurseries and early years setting remain open. So during the pandemic, Merton's continue to fund all the providers who were expected to deliver 2-, 3- and 4-year-old funded places, and the overall supply of places continues to broadly meet parental demand. From January 2021, funded education providers are expected to continue to provide childcare and early learning to all families, and not just key workers and vulnerable children. And our early years provider support team continues to give quite significant guidance and advice to support all early years and childcare settings. We have had an update in effect from Dagmar's slides, which we're looking at what we have had a couple of nurseries who've had to close just recently due to COVID-related staff sickness and self-isolation. And I thought you might also be interested to know a little bit about the local sort of take-up. So the data about take-up in the autumn term 2019 and autumn term 2020 shows a drop. Which is not going to surprise you, but a drop of 2-year-old take up of around 100 places, which is about 23%. And in the universal entitlement for 3- and 4-year-olds of around 221 places, which is around 8%. We've seen a small increase in the 30-hour take up of about 37 places, 5%. So with an anticipated overall reduction in the spring term, now it's expected that the early years DSG budget for 21-22 will be negatively impacted in spite of a raise in the hourly rate for each place taken up, and that's because we won't have so many children in. In terms of Merton schools, so obviously they're open to vulnerable children and the children of key workers in all year groups and nurseries, obviously following the early years guidance. Although, as you will be aware, there was some confusion around that in that the school's guidance and early years guidance didn't align, and so that was aligned at the end of last week. So that made that clearer. We do, as Hannah said, meet every week separately with secondary head teachers, special school head teachers, and with primary cluster reps. To have really good engagement in those meetings, a really good place for schools to come and talk to us about any issues they're having and for us to help them plan, and also to get updates. And we also provide an email update to head teachers every day at the end of the day that sort of makes sure they're tied into all the latest updates, of which there is many changes. And so I've just signed off this evening's, and there were 9 updates for head teachers, and that is pretty standard. So there is an awful lot of information that they're wading through. So the numbers in schools at the moment is varying considerably. Some schools have a large number of pupils attending for face-to-face, which is making head teachers quite nervous about maintaining social distancing. In the spirit of the broader lockdown guidance, even though the social distancing guidance in schools has not changed since before Christmas. I think it would be true to say that it has been a really stressful time for head teachers, and the constant change in guidance and the changing situation is making it quite difficult for them. But secondary schools, our numbers are not very high. We've got about 30 pupils face-to-face in most schools, up to about 56 in St Mark's. We have a huge variation across primary schools, but some of our primary schools, particularly in the west of the borough, are reporting numbers of 80 to 100 and some over 100. So some of those schools sort of a bit more concerned about ongoing, how they're going to manage that, as well as the expectations about remote education. And the feedback in schools is pretty mixed about the number of nursery pupils coming in. Some are worried that if they have significant numbers coming in, they won't be able to balance staffing their nurseries, delivering the remote education and the face-to-face. So they're thinking how they're going to manage that. And in other schools, we've got reports of very little interest in sending their children into nursery. So it varies very much. In terms of the asymptomatic testing, so you'll be aware that secondary schools now have those tests. They were in over the Christmas holidays, making sure that was all ready to go for the beginning of term. So, and they're reporting mostly positive experience with that testing. So at the moment, they are testing weekly staff with the lateral flow tests that Dagmar was telling us about. And they've done 2. They got consent to do 2 tests for those children that are in, and some of our schools have now got consent from parents to do weekly testing on secondary age pupils as well, who are coming into school. So that's different than what was originally planned, because originally it was planned to for schools for children returning to do the asymptomatic tests for all children returning, but as you're aware, obviously it's a much smaller number that have. Consent has been an issue for some schools, reporting that parents are not giving consent for their children to have those tests, and a very small number of staff also not giving their consent to be tested. So as I say, some schools keen to start do weekly testing of pupils and staff to keep them safe. So the primary testing, we've literally heard today that those tests are coming out into primary schools week beginning the 18th. So that just came in around about 6 o'clock this evening. So we wait to get the further guidance on that tomorrow. And there's also, obviously, as Dagmar talked, we're looking at our staff that are going in and out of schools to support those children with education, health and care plans, to also access our local testing centres to get weekly testing. So in terms of the digital devices, so all schools have been given the chance to order their allocations of digital devices from the DfE. Some schools are reporting that is adequate for their pupils' needs. Others are reporting that they need more. And obviously it's a bit of a moving picture, because with a sort of fluid number of children coming in and out of school and needing those, we keep that under discussion with schools. And schools are also sourcing devices from other places, so for example the Dons, through Keeping Kids Connected, and are very grateful for those. And also we have a small amount of money put aside within the council to buy more of those devices. We constantly ask schools whether they need more, how things are going for them. We don't. They've got an awful lot of things going on, so we don't always get a comprehensive response to that. But it's probably worth saying that in the latest Ofsted guidance around remote learning that's come out, they are recommending a sort of quite a mixed picture, that some of it would be online lessons, some of it would be live lessons, some of it would actually be appropriate to be worksheets and books. And we know that there are some families who are asking for the work to be sent in that way. So our schools are doing a real mixture of provision for pupils. So for all those pupils who are at home now, they have some access to remote learning, hopefully. Certainly our schools have really developed their skills in remote learning since the first lockdown, so that's been something they've really worked on. And I know feedback from parents and feedback from schools that they're getting from parents is that that is getting better all the time, and is definitely improved this term. And that's often a mixture of pre-recorded lessons and some live lessons. So our Merton education partners, that's our school inspectors, are spending time with their schools, talking to them about the quality of remote education in their remote visits to schools this term. And the government has just released a checklist that obviously we will be using with schools to enable them to think about that learning. School attendance is no longer compulsory. But for vulnerable children it is expected, and we certainly are encouraging schools that they should support schools as well who are children critical workers where they can. So just so that for your information, all penalty notices have been ceased. So there's no penalty notices being issued at the moment. We're monitoring the elective of home education, which increased significantly in the last lockdown and has continued to go up, so we are running, as we did last time, COVID children missing education processes. So that's an ongoing process we normally have. What we've done is ramp that up, and we meet more frequently, and particularly with colleagues from social care, to go through every child that's open to social care, to check whether they're in school, and if they're not in school, whether they should be, and how we would support, whether we feel that would be beneficial to support that process. So that worked really well last time in encouraging children to go into school where it was beneficial for them to be there. So in terms of our youth centres, they are closed at the moment again. for big groups, but we're providing one-to-one support for young people who are anxious about their schooling, family issues, telephone calls to young people to check on their well-being. So youth service staff are developing online activities also. We're monitoring our young people not in education, employment and training in the way that we normally would, and support them around that. And we also, in the last lockdown, had a detached youth team who went out into the community to engage with young people and support the social messaging about keeping themselves safe. And so we are going to start that again now. So just picking up on special educational needs, so special schools, we need to go to the next slide, sorry, Stella. Special schools remain open to all pupils. That obviously has been very stressful for our special school heads, particularly for those children who need an awful lot of care and input. So they're working very closely with those special schools and with health partners to look at how we provide so as many children as possible can attend and get the education they need. But we do, as you would expect, have quite a number of parents who think it is safer to keep their children, young people at home. So the testing in special schools is for all staff in special schools, that they've already got the lateral flow tests, and there is planning for delivery of the tests to secondary age pupils in special schools, and we're planning that again in partnership with health partners to ensure that that can take place in a safe way. That has taken a little bit longer to put in place because as you would expect, our special school staff are very keen not to be distressing children and young people, and to be clear that they can understand what that process is. So that is something that we're working on. It's worth noting that the government has not made any temporary changes in this lockdown as it did in the first lockdown around the special education needs and disability legislation. So that means that the local authority in the CCG is required to deliver the provision outlined in the education, health and care plans. That obviously is quite a challenge, and certainly there's lots of discussion with the DfE in terms of whether that is a tenable situation moving forward, particularly as there may be redeployment of therapy staff within health services that will make that very difficult to deliver. So that remains a difficult thing for us, but the phased transfers are being progressed in order to name reception and secondary provision by the timescales outlined. So those all things are carrying on as they should. In terms of free school meals, councillors may be relieved, particularly after all the press around the hampers, to know that in the vast majority of our schools, certainly all our schools that buy into the catering contract, families had vouchers in the last lockdown, and they will be having vouchers again this time, and the government's central voucher system will also be coming online soon. And we did have a few schools who were not in our central contract who did try hampers and have stopped those very quickly. So that means that all of our children, families should be getting vouchers. And then in terms of school admissions, just to again reassure you that admissions are carrying on as they normally would, and secondary offer day is carrying on as normal on the 1st of March. And we do not have any yet in our homeschool to transport. We don't have any COVID related impacts in relation to that so far, and that is probably, as you will have picked up in the budget discussion, we have fewer children we are transporting because there are fewer children going to school, and we work closely with our public health colleagues to make sure that homeschool transport is as safe as it can be. Stella, can I have the third slide? So this is just, I won't go through this in lots of detail, but this is just to give you a bit of a flavour of some of the feedback that children and young people have been giving us during lockdown. So our detached youth team, our youth workers in their one-to-one and in the group sessions, and in the time when they were able to be open, doing quite a lot of finding out from children and young people how they're finding the experience of COVID generally and the lockdowns, and as you can see, that there's a kind of mixture there of enjoying not feeling the pressure, some of them worried about falling behind, missing seeing their friends and missing physical activities, but also, and we know, and secondary colleagues are feeding that back already at the moment. So some of the online learning works well, but actually it's really hard work doing everything on a computer and doing intensive online lessons. So already our secondary colleagues are talking about a mixed economy in terms of live lessons and allowing some studying based on setting tasks, so that actually it's more of a mixture as it would be. And then if we go on to the next slide, Stella, and I'll hand over to David.
Hi everyone, how are you doing? So I'm deputising for our Matey tonight, who unfortunately couldn't be here tonight, and I'm the head of service for children in care and resources. So yeah, I think the main thing, I think it's a very challenging time to be working in social care right now, but I think the main thing to get across is our social workers on the front line are still trying very creative ways to engage children and families, and how they actually support families and children, which is really encouraging. With the third lockdown specifically, there's a lot of challenges because of the higher infection rate, and I think this is causing a lot of anxiety amongst both staff and families, with question marks around for families, you can imagine, well, why is a social worker coming into my home when it's a risk here? But changed our operating protocol again to reflect the current situation. So we've reverted back to only doing essential visits, and any workers going out are required to use kits, which is to give them confidence, both the families and workers, that we're taking steps to minimize infection. There are 200 more additional families in the service than there have previously been at this time last year, and a lot of that has to do with families coming into the service. The needs there, but they don't have those resilience and strength factors around them, partly because of lockdown and partly because of contextual services, but also stepping children out of the system where a lot of support services might not be there that have been, including professional support services, but also family resilience support services, which due to lockdown measures, which is very challenging. There's also greater expectation in this third lockdown that business as usual and visits sort of continues as they had been, which is slightly different. And you look at the statistics here, and it's about 50-50 to virtual visits as opposed to face-to-face visits. So moving on to MASH and first response at our front door. So the MASH team is stable and continues to function virtually successfully. The first response team is the most hard hit by COVID. Currently, we've got about a quarter of the social workers that are unable to work at the moment due to either self-isolating or COVID-19 infection. And once again, caseloads. So currently the average is on 19 in that service. I believe the target is around 12 to 13 in normal times. And because of the disparity with ASYE, so newly qualified social workers, some of the more experienced social workers are sort of mid to high 20s. So caseloads are very high, and it's challenging at the moment. We could go on to the next slide, please. In the middle part of the section, the service, the safeguarding and care planning. So it's fairly stable with 2 staff members currently impacted with infection or isolation. All our children have risk assessments to inform the frequency of visits, and keep in mind that we only do essential visits. Visits are needed, so we've got a clear strategy on how we decide what is essential and what's not essential. And this is where a lot of the children that are coming in, but we're sort of struggling to step them down, and a high amount of children in the system, and once again sort of high caseload. So some social workers holding up to 25 children. Great. And we have I should have mentioned before, we have because of this higher level, we've mobilized more 2 extra service managers in the system to help operationally. And the children care service resource team, there's no COVID-19 issues. Well, there's one social worker actually, and and once again, because of the pressures going on in the front part of the service and the middle part of the service, we agreed to accept a significant number of children in the court proceedings, which is not usually the remit of my service, but work together as one organisation, obviously. But that's causing extra challenges for the social work teams in that service, which is good. And there's also ongoing strong partnership works between health and I think across the service, we're all working together as well as we can be. Care experience young people. One member of staff absent due to COVID infection. Face-to-face visits are only happening where the risk assessment deems it to be necessary, but there is a higher level of virtual visits. And I think that goes across into the children and care team too. Whilst the face-to-face visits might be less, what we actually have experienced is sometimes closer relationships with both foster families and children because of the higher amount of virtual visits that we were having. That's one of the positives we've taken out of the past year of working. And yes, and also to note that the winter grant for our care experience young people has been paid, and for additional allowance around the needs of food, internet, and heating cost, helping through this very difficult time. And the adolescent family service, it's stable. Practitioners continue to find creative ways to engage with children and young people in the context of lockdown. We can go to the last slide. Courts are still operating for the youth offending service. And yes, going to secure settings is very challenging, and but we use an alternative virtual methods when necessary. Quality assurance and professional development is no impact. There is a higher number of child protection conferences being required because of what's going on in the system, and there's still online training that's ongoing. The business support team they've also been hit by COVID with 3 related absences, and they've the last table there that you can see is around our devices. All the children that have had one allocated, we have, and we've got a stock for new children coming into the system that require those devices. There we are. Thank you.
Thank you, David and Jane. Any questions, please? Right. Anybody else in mind? Ailey, and then Nick, and then Omar.
Thank you, Chair. And thank you to Jane, David and Hannah for pulling together these slides within 48 hours. But personally, I have got questions, but I want to say I actually found that process really worked for me personally. It might be good to get some feedback from the other panel members, but I thought it was very succinct and very to the point, and I think it really delivered the message. So thank you for doing that. My question is for David. I'm really concerned about the 200 additional children who have social care needs year on year. And I was wondering, my first question is, how does that compare nationally in terms of the increase? So is Merton pretty much the same? Is it expected, or is it better or is it worse? So that's my first question. I'm also concerned with the percentage with which those children who actually required the social care actually now have a child protection plan in place, which I understand from the stuff we were sent last week is about 52%. I would have hoped that requiring an actual plan, that figure would have been lower. So I wonder whether or not you could actually comment on that. And then my third question is, in terms of the social workers' caseloads, what can be done to reduce those back to normal levels? I mean, can we bring in, I know, agency potentially, but my main concern for that is the impact on those individual social workers, but also the impact on potentially the children not getting the social worker care that they actually require during these very difficult times as well. Thank you.
Right, Nick, please.
Sorry, Councillor, what was that? Response?
Me first, isn't it?
Okay.
Is it me? I don't mind. Okay, very quickly. All my questions go to Jane because we still haven't talked about that. And Jane, thank you very much indeed. a lot of this is probably down to my own ignorance, so I'd like you to help me on it. First of all, I'd like to know why the numbers of kids coming in primary are so much proportionately higher than they are in secondary. And I'd also like to know, how that works in the borough. I mean, you suggested that from from the east of the borough tends to be higher than the west, but I'd like to a bit of a breakdown on that. Second of all, consent issues. That's the thing that really worried me. First of all, where there's no consent for the children, how are those children educated when they come into school? And the one that worries me even slightly more is where staff are refusing to take tests. Are we allowing them to work, and are we involving the unions in trying to persuade them that they should be tested? And then last of all, I'm sorry, it's a bit of a list, this remote and face-to-face mix. Where there's a high attendance, like for instance in some of those primary schools, how does it affect the ability of staff to deliver remotely at the same time? Because I know that elsewhere in the country that has been a real issue. Thank you very much.
Okay. Omar, please.
Thank you. I'd like to also echo what Councillor Haley Ormer had mentioned in regards to the presentation being useful and an effective means of communicating key points and highlights. My question is kind of similar to Councillor Draper in relation to how potentially the increase in students who are now turning up to school rather than kind of as the list of key workers have increased, and the impact that's happening on schools and how they're able to deliver that multitude of face-to-face learning and virtual learning, where we know there are multiple teachers in schools that are off sick due to COVID, and potentially the strain that certain schools have where they have a higher uptake of students that are having to the high uptake of students that are having to come into school rather than obviously undertake virtual learning, and whether that's potentially impacting both sets of students because schools are unable to adequately teach students online and in class because they have that shortage on both sides. Thank you.
Thank you. Okay. So, David, are you going to answer? Oh, no, sorry. I know. Yeah, David, are you going to answer some of those?
Yeah, sure. So how we compare nationally, I don't have the stats with me, and I will invite my colleague Carl, if he does have information around this, to jump in. But as I understand from my partnership work with around the boroughs, it is challenging across there. So I'll be very surprised to see that this isn't varying what's going on exactly. It's definitely councils across the country are struggling, but I don't know the comparisons. Percentage of children who actually have a child protection plan in place. So in the actual updates, it was touched on there. So it was in page, or gee, I've lost it now.
David, it was page 2. It was 52%. So yes. It was 52%.
Yes. So 52% is the answer for that. And I suppose why with child protection plans specifically, there was a section in the first lockdown when we made the decision to not bring children off plans because of safety reasons. So there is that lag from that, but there also is that existing a lot of safety for families that we usually be looking at don't exist. So there might be a bit of for many reasons, but obviously we want to make sure that our children are safe and doing a very utmost for them, and certain safety factors that we normally look for are more difficult to find currently. What is worthy to note is that our numbers of children in care aren't drastically changing. They're fairly stable, so it does show that we are keeping children safe, which is, I suppose the most important thing. What could be done to reduce the levels? I mean, in the papers, we sort of have highlighted around the recruitment that's gone on in each of the teams, and we have had some success around there. I mean, the strategies that we set around my service, taking a lot of the court work out of the middle part of service to help as well. There's some other ideas around how we can do some recruitment, some creative recruitment ideas around newly qualified workers. So in our recruitment, we get a lot of interest from newly qualified workers who have protected caseloads, which puts pressures on other people in the system. But we're trying to think about how we can work creative around that with some ideas. And obviously the COVID hits part of the service. I mean, there is with the extra testing, we could experience more of this. But we're hoping that those staff members will come back healthy and sort of up and down. But it is a difficult time.
Okay. Are you asking for Carl to step in, David? Did you mention that you wanted Carl to add something?
Carl, I don't know. Sorry to put you on the spot. I don't know if you do have any comparative data off the top of your head around with other authorities.
So was this in relation to the virtual visit versus visits in person?
No. With the 200 additional children in the system.
Oh, okay. So no, just to so I haven't got the exact figures, but I can say that anecdotally this seems to be a trend that we're hearing from other authorities. So specifically in the sort of performance community, there were some emails recently and some some data was sort of shared comparatively, but very informally. I don't think this would be something that we could kind of play into this space, but it did seem to suggest that most authorities are feeling this. I'm sure on a pan-London level, discussions between directors are happening, and if this was something that this panel wanted to look into, I wonder whether there is something in the London ADCS, for instance, Hannah, that we could pull in. So on a quarterly level, I know that there is some data, but again, we need to be very mindful of sharing other authorities' data and how that can be potentially identifiable, by authority. But in general, I think we can say that it's a trend that we're seeing nationally.
Carl, I do appreciate.
Hannah, just one minute, Ellie. Hannah, were you trying to say something?
Yeah, I think what I'd like to do, Chair, is if you can allow us to go away with this.
Yes.
There is some data out there, Councillor Onrod. I think Carl is right to put caution about what's shared and what's not shared, but there is definitely a trend in London and nationally. For the very nature of how the work is being undertaken because of COVID-19. I think we understood very early on, going back in last March, April, the cases were going to rise. Mm-hmm. We were very clear about that. And the paramount issue there is keeping these children safe. So our thresholds have probably gone. We've expanded our thresholds because of that reduced kind of interaction that we would have, pre-COVID-19. But we can certainly look at some benchmarking data for probably London, but also for Southwest London, because I think sometimes when you bring it down into sub-regional levels, it gives a better kind of view. But all of the things you're hearing tonight, we're not an outlier in any way. The school numbers that you've raised, a massive issue, can I just say, in some London boroughs, where they're really struggling because, of course, it went from the definition of one key worker, which both parties are either part of being a key worker. The definition of vulnerable children has changed, and that has expanded. So even though this is the third lockdown, it is very different from the first lockdown because some of the work that in a way was relaxed and suspended through legislation in lockdown 1 hasn't happened this time. So the activity will continue to increase until we get back in, I think, to those normal kind of routine visits. And I think David would agree with me that the kind of priority will be is to get families settled as quick as possible, and make sure they are safe and getting them off plans if they can come off plans. I am encouraged, and I think you should be encouraged, panel, around the fact that our numbers of children in care are not rising, as David pointed out. But I want to reassure you that we meet weekly, and I certainly meet with Jane and Elle every week, I think we meet one-to-ones, but then we meet as a group as well. We are very, very conscious of the workforce. And I think, to be honest, there is a fatigue across all workforces at the moment, across both care services, but also across healthcare. This is our third round, and there is a little bit of fatigue. So we are very conscious of how we look after our staff, and we spend part of our morning this morning having a discussion about what more we can do to support those staff, not just the staff on the front line, but staff that's working at home and probably feeling a little isolated and fatigued as well. And we've got some things in train that we will put in place. I'm physically in the building a couple of days a week. I do the rounds of the floor, so staff that are in get that physical face-to-face at a social distance with me as well. So we are very quick to pick up on issues, and I don't think any of us in a pre-COVID or in a world where we learn to live with COVID and manage COVID would accept those kind of levels of cases. We would want to bring those down rather rapidly. I have agreed with El Mayhew and David's side that we are going to put more resources in. I think it's absolutely right to put resources in, and that is the cost of COVID. We have, we're not in a place where it isn't COVID related. We have the evidence base that it's COVID related. The challenge we have is that every London borough is also out there looking for staff. So we're getting some very positive messages out to agencies of why would you want to come and work in Merton, and the support we can offer agency workers that come into our services as well. Thank you, Chair. I leave it there.
Thank you very much for that. And I think we are aware that you're working under very difficult circumstances, and we'd like to thank you all. And we haven't quite come to the end, so I better not say too quickly. And the papers that you've got and the vision that we had following our pre-meets has worked very well. I'm an active learner, so I much prefer to see it than to just read in books. So that was very good. So when you find the data or get them, could you just circulate them to us, please?
Of course, Chair, of course. Let that with me, and we'll do some work from the London data set to see what we can get for you.
Right, thank you. And Henry, can you be quick about this?
No, that's fine. No, Hannah's covered it. It's fine. Don't worry. Yeah, that's thank
wonderful.
you.
Thank you. Now, I have a problem because we've got two things. One that involves most people, and the other one is pretty quick. And that's the performance monitoring report. And so we have just gone 9.
Chair, I'm sorry, you've missed out my question. It doesn't matter. I know it was by accident, but I was in your list and I haven't yet.
I am so sorry, James. I wouldn't do that. You know that.
Oh, no, I know that. I said that. I know it was by accident, but is it okay if I do mine now? Is that okay?
Okay, go ahead.
Hang on, Chair, before you do, I don't think I've had an answer to my questions yet.
Well, do that first then.
Okay. So there's both of you then. Because I've got your name down here, Nick, but I didn't have James. I'm sorry about that.
No problem. No problem. Are you going to go first, Nick, or do you want to repeat your questions?
No, I've got them. I don't.
Okay. Okay. I'll say mine then. So Chair, just first was a quick comment. I agree with what everybody else has said. The reports are really helpful tonight. But can I just ask you to consider? You don't have to give an answer tonight, but can you consider asking officers next time to send these reports out before the meeting, even in the afternoon? Because with the nature of it is we've got literally just a few hours in the whole year. It's the nature of the council calendar to fulfil our responsibilities to offer challenge and support and questions. And I can see the directors nodding ahead, so thank you. And of course, those hours are being cut down by having these reports presented at the meeting. So just an observation for you, Chair, to think about.
I would just like to step into that. The reason why you've had that extra, it's not because it was meant to be there. It's a discussion following our pre-meet. And I'm really, really pleased that that was put in. So I hear what you're saying, but it wasn't a planned way of doing shortcuts. It's not that way.
Okay. Now, I certainly understand it's special times, but of course it is cutting down our time to ask questions. So I've got two brief questions. I'll briefly describe what's written there so people don't have to go. I know we're short of time, but of the written report, 220 on page 4 talks about social workers in schools, and 2.25 talks about trainee social workers. So my question was, is there an opportunity there to have that temporary support that we've discussed this evening, particularly with trainee social workers? Is there an opportunity? They would obviously need to be supervised and work closely with more experienced colleagues, but is there an opportunity to plug the gap? And we've heard a number of members and officers talk about that this evening. So that was one question. And then my second question is on the devices. We've heard this evening that some schools are not responding to questions, but it is fairly critical. We do surely need to tie the schools down and ask the definitive question, how short are you of devices? And then an observation, which I think I've raised before, we know these are challenging times, but given that we hope that every pupil will soon have a device, given the Cabinet member's own personal interest in this sort of sector or field, is there an opportunity? I know we're all incredibly stretched at the moment, but is there an opportunity to do a real piece of work on how this can be turned to our advantage in the years ahead, and how these devices can be used to enhance learning? And there is a lot of work to suggest they can be, and there's a task group which I and others are members of, which has had to pause for the moment. But I really just want to flag this again. This is an area of massive opportunity for us, I'd have thought. Thank you, Chair.
Okay, thank you for that. Can I just say something? I'm glad you mentioned about devices, because that came out as one of the things for task force, and something completely different was taken up, considering it's COVID time and we all need these devices. So probably that's something we can look at a different time. But I'm afraid tonight we can't look at this because time is already running and we still have a couple of questions. So if you don't mind, we can pick that up and either write so that everybody gets your answer, and pick it up and deal with it at the next session, if that's okay with you.
That's fine, Cheryl. That does reinforce my earlier. Thank you.
Okay.
So can I pick up on the devices one first, and then I'll come to Councillor Draper's question. So I suppose I want to put a caveat. I'm not suggesting schools are just not telling us, Councillor Holmes. It's in the keep going back and checking how many more they need. It's a very fluid situation. The DfE are constantly opening their portals again and allowing schools to order. So it's a moving picture all the time. So we might go out at one point and they might say, okay, I think I need this many devices, and then literally they'll be able to order some more devices. So constantly it's finding out how many more they can order that have been released, how many they might be getting from other sources. So pinning down exactly what it is at this moment in time for the changing group of children. So I would not like this I would not like this panel to think that schools are not interested in it or responding. It's just that when you're saying, can you tell me today how many devices you need, it might be that what they've just done is order them and they're expecting them within a period of time. And the other thing probably worth noting on the devices is that actually there is a difference in different schools. So some schools might be saying what they need is laptops, and other schools are saying I don't need any laptops, what we need is more dongles, more internet access. And that is also a changing picture, because we're aware that some families, as we continue in this, come short of money, make decisions that they don't pay for the internet access, or they can't afford to do that, and therefore children might need more of those sort of dongle devices. So it's a bit of a moving feast. Schools are very much onto it and very much monitoring how much children are able to access. So I really don't want you to go away with the idea that schools are not actively working on this. It's just for me to come in and say at this point in time we need 250 devices. It would have already changed by tomorrow. So
okay, thank you.
Okay, so I think part of the so I'm going to go through the question. So why more children in primaries than in secondaries? I think that's probably a mix of things, but I imagine it's probably, I mean, evidence would suggest it's that primary parents who are working are more likely to want their children to be in school. Secondary children are more able to work on their own at home. So if you've got parents who are working from home, they may well not be able to supervise their primary age child because they'll need help with that learning, whereas their secondary age children will be able to do it on their own. So I think that's part of it. I think some of our secondary age pupils probably say, if a mates are not going in, then I'm not going in either, even if I could take up a place. So there's a mixture of things. And certainly I know that from secondary perspective, if they monitor, they are monitoring how much is being accessed and how much work's being done. And so sometimes they actively encourage young people who are finding it difficult to work at home to then come in. So we know during the last lockdown that as time went on, some young people themselves wanted to come in because they found it difficult, and schools actively encouraged others. So I think that's the reason why there's a difference in primary and secondary. It's actually the other way round to the way you said. So actually both in the last lockdown and this lockdown, we have fewer children coming into school in the east of the borough in primary schools and more in the west of the borough. And that was the case in the last lockdown. Also, generally, that's what happens. So our schools in Wimbledon, much higher numbers of pupils coming in than our schools in Mitcham.
Oh. Okay. Thank you very much for that, Jane, and everybody else. Can I just speak to Stella for a second? Stella?
Yes, I'm here.
I know that on something that I read, 7:15 to 9, and we've already gone past that. Do we have any more time on the system?
Yeah, it's fine, Chair.
Okay, great.
It won't cut you off. Yeah.
Thank you very much. I'm sorry to keep you, but Nick, can you just please wait a minute?
Sorry, I asked 4 questions. Jane, will you be able, if it's not enough time to answer those questions now, if you just send me something in writing, that would be fine, or send it to the group. But I did have 4 questions.
How would you like me to play it, Chair? So the others were around consent.
I think probably just cover them so that nobody misses out.
Okay. So I think the other question.
I have questions outstanding as well. So if there's no time this evening, could there be written responses to those too? But I'm sorry to say it again, but it does reinforce the point I made earlier about getting reports in advance. But thank you, Chair.
James, if you is that okay? Did you want Jane to answer your questions as well?
I think I answered. I think it was.
Yeah, no, I think more for David, but happy.
I can answer that very quickly.
Right.
Thank you.
Okay. Can we just have some order? Jane, could you please answer Nick's, and then after David, we'll answer James's, and then we don't have to have anything carried forward.
So I think it was consent, pupil consent, staff consent, and then the remote face-to-face mix and the impact of pupils on remote. So I think the consent, so we need to be really clear that the lateral flow tests are not compulsory, that they're not mandatory, they are always by consent. So we have very few staff who are not consenting, and schools are generally managing that in the way that they, so maybe those staff can be the ones working from home, delivering the remote education. So different schools are managing it in different ways, and it's a very small number. In terms of pupils, I think the secondary schools are sort of, I think, raising that as a bit of an issue, but again, at the moment, definitely the guidance would be they don't have to take those tests. It was never the case, even when all children returned, that if they didn't have consent for the test, they could still come back in. So I think it is a worry. For schools, it is a worry, but at the moment it's really clear that it is with consent. In terms of the remote face-to-face mix, although head teachers, and this is primary head teachers, are raising some concerns about the numbers of children in and the balance. So far, they have found very innovative ways to manage it. So I think we need to recognise that our head teachers are under tremendous stress, but they're doing an amazing job. So they are managing it in a number of different ways. So even some of those staff who are self-isolating, obviously if they haven't got symptoms, they will be delivering some of the remote learning, and they will have different. So they've also got it on a most of the schools on a sort of rota basis. So it's not the same staff who are in all the time. So there's some mixing. So at the moment, we have not had the situation where a school is saying, I have got so many children in that I haven't got any staff to deliver the remote learning. But I think what they're flagging is, if, for example, we had a big influx of nursery children, that would create problems because of the way nurseries have to be staffed in terms of the ratios. That could create a problem. Certainly, I know that what's on the ground, what some of our schools have done is gone back and had a conversation with their key worker parents, because obviously for our vulnerable children, we do want them in. with key worker parents just to say the numbers are quite high. If you're able to keep your children home for at least some of the week, that would be really helpful in terms of managing the numbers. And they're reporting back the parents are being very positive about that and saying, okay, I could actually have my my children at home. So at the moment, not got to the point where that's an issue, but you're absolutely right. We are really keeping an eye on it. And that's why we meet with the cluster reps every week, and they talk to their clusters, they talk to us, and we'll look and see what we can do across the board if we get into those kind of problems.
James, what was it you wanted dealt with, please?
Yes. So the question was around students and if they could provide extra support, Councillor Holmes, I understand. Okay. So, and you mentioned social worker in schools and frontline from the papers. So social worker in schools isn't necessarily anything about students, about positioning social workers actually into schools. It's a project from the What Work Centres, which I might add is we've got funding from that as well. So I'm glad we have that funding, because I think we'd be under added pressure if we didn't have those social workers that were managing those children from that base. And in the front line, which is a very excellent sort of step up into social work for graduates, where we're stepping up from one team to 2 teams, but that won't start until September. But that's definitely going to help us in the long term to get extra capacity into the service. The idea of actually having students come in to sort of help us out in the crisis is a good idea. The NHS have beaten it to us. They've contacted the universities to actually mobilise students, social work students, to help out with the hospitals. And as much as we are struggling, I wouldn't want to take that resource away from the hospitals in this situation. And it was something they tried in the first lockdown too. But so to answer your question, there's thinking about this, but it's possibly not going to help us right now. There is a kickstart with giving people an employment. I can't remember what the name of the program is, but I know I've potentially got 4 positions of people coming in to help sort of more on a sort of BSO level to sort of help out with social workers. Another program that we're trialing. I think it's Kickstart to Employment, I believe it's called.
Thank you very much.
Thank you. Okay, so the second to last item on the list is performance monitoring, and I think that's Hannah.
I'm on mute. So I'm going to hand over to Carl, please.
Okay.
Thank you, Hannah. Thank you, Chair. So you have 2 items in front of you, which for members of this panel will be familiar. For new members, this is the performance dashboard with a list of indicator and a cover report. My role is to highlight any changes or any areas that are where our performance indicators show performance concerns, and also to highlight any areas where there may be data quality issues. So for this report, there are 3 indicators that are rated red, and it's fair to say that all 3 are almost an immediate result of the COVID impact. So the first one being the ability to issue education and healthcare plans within the statutory 20-week timetable. So there's been an impact in terms of how we are able to receive information from our partners in relation to COVID and the work pressures that we're experiencing across education and health partners to contribute to these plans. The number of weeks it takes to complete care proceedings, equally the COVID impact on courts is a fairly obvious underlying reason, and you can read the service commentary in the report. And then the last indicator where we are reporting a red is the number of in-house foster carers that are recruited. And again, you can imagine an impact of COVID on our ability to run recruitment campaigns such as drop-ins or conferences or promotional conferences or anything like that. The type of things you would normally expect an authority to undertake to increase their cohort. That being said, in all 3 areas, it's not that work is stopping. I think it's a very important point to make. We are finding different ways of trying to meet these important targets. We've already heard, but I will reflect on this again. We've already heard about the impact on caseloads. Now you will see that borne out in the data, but maybe not in the way that you may have heard this evening. So the increase in the caseloads, when you look at the average, might not appear as masks maybe the drastic impact it has on some teams in our service, and that is the law of averages, I guess. You know, just looking at an average figure masks the fact that there's maybe a big range, and certainly for some social workers, the average caseloads that we're reporting, I think at the moment at about 18, is far from the truth. They are working with 20 to 25 families, or even more in some cases. I'll stop there, Chair. Those are the areas that I needed to highlight and bring to this board's attention, and I'm happy to take questions, and hopefully together with Jane and David and Hannah will be able to respond.
Thank you, Carl. Anybody with any questions? No, probably very succinct. Nobody wants to ask anything at the moment.
I obviously note Councillor Omerod's request for additional data around the increase, which we will respond to in writing.
Okay.
Thank you, Hayley.
Thank you. Right, so that's the end of that, apart from the work program. And so, before we even look at the work program, I'd like to say thank you very much to all the people who presented tonight. And I probably will call names so I don't leave anybody out. And so I would say Hannah has been, I'm really, really pleased that you've stepped up to the breach and doing 2 jobs. Hopefully you get time to go home. Well, you're at home now, I suppose, but sleep something, have a rest. And also,
thank you, Chair.
You're welcome. And Carl, as well as before I mix up all the names here, I've got them written down. Jane, and we go back a very long way, but you've really taken this on, I don't know, and I'm really, really proud of all of you, really. David, we haven't met before because there was somebody else you're stepping in for. Absolutely brilliant as well. Our 2 cabinet members, who, I don't know where Tobin is at the moment, can't see him, but anyway, our 2 cabinet members for the work you're doing. And really for the whole panel, because this is not easy. And COVID is, we have no idea when it will come to an end. And it's not something you can talk to or someone. So we'll just have to keep on supporting each other. Thanks for the panel for all their questions. And hopefully, I didn't mean to upset anybody by missing anything out. James, we go back a very, very, very long way. So I do know that you want your question answered.
Chair, not at all worried, but thank you.
Okay. So I think that's it, except for the worksheet. And I will just add that there isn't anything, unless you want to see something, apart from the name changes, because it's Rachel who is on there and instead of Hannah. And I know you're temporary somewhere, don't know, but we still have to change it until such time that you move on. And so thanks everyone. And Rose, I hope you enjoyed the evening, and I hope we'll see you again.
Thank you very much.
So have a great evening, everyone. And I've really enjoyed being and listening to everything. And please thank all the staff. I think that their well-being is very important to us and to our children. And really, they're doing a fantastic job. I work in some of these. I won't bother to tell you about my background in health and social care. And so I know how hard it can be. But they are doing a fantastic job. And if we work together, we'll get to the end. Thank you so much. Have a good evening.